How's it going, guys? It's the Critical Care Coach here. Really quickly, I wanted to talk about vasopressors. Now, vasopressors are medications that you'll commonly see in the critical care sector, and these are medications that are used to raise your patient's blood pressure back up. Your patient's blood pressure may be running low, somewhere in the 70s, 80s, and you're ordered to give vasopressors to help bring that back up to a normal range, okay? Now, typically, they want to see a MAP above 65. Every now and then they may say above 60 is okay, all right? Now there are several different kind of pressors that you'll see, but today I'm only going to talk about two really quickly, all right? These two medications are Levo and Vaso. Vaso, also known as vasopressin, Levo also known as norepinephrine, okay? Now, Levo is actually the first line based on your protocols, but most places Levo is the first line pressure that is ordered for the patients, okay? And then if for whatever reason the Levo is not working, they may be asked to add on secondary pressors, okay? Now some quick facts about norepinephrine, all right? It's gonna come in a 4 milligram inside of a 250 ml bag, all right? The dose is usually ordered to start anywhere between 1 to 12 mics per minute, okay? However, when you reach a certain point, you will be asked to put on a secondary pressor. And if you're not asked, you need to know to notify the provider. The norepinephrine is a titratable drug. So you're going to titrate 1 mic every 3 to 5 minutes. And of course, every time you reach that 5-minute marker, whether you do or don't have to titrate again, you want to make sure you document what the vital signs are, just so that anyone who's looking at the chart knows that you actually checked it and you're able to see whether it worked or whether it didn't work, okay? So as I said, once you reach the 10 mics per minute marker, this is the time that you want to start considering adding a secondary pressor, okay? One of those secondary pressors, of course, as I said, is vasopressin. This is going to come in a 20 unit inside of a 100 ml bag, all right? The dose is going to start anywhere between 0.1 to 0.01 to 0.04 units per minute. Now, the biggest difference between these two medications is that vasopressin is non-titratable. This means you're not going up and down. Whatever the order states, you're going to set it and just leave it there. You're not able to go up and down on this medication like you can on the norepinephrine, okay? These two medications are going to be placed on two different pumps, all right? The one thing you need to know about these medications is whichever line, and this goes for any lines, any drips that you're running, whichever drip is running faster, this is the drip that's going to be running directly into the patient's peripheral line, all right? The medication that's running at a slower rate is the one that's going to be Y-sided, okay? Now, the reason for that, if you were to do that in reverse and put the slower medication more forward and the faster medication being Y-sided, you're going to bolus the slower medication into the patient, okay? So instead of your order being 0.01, because you're bolusing it, you might actually be giving more of a dose than you're supposed to, okay? So you want to ensure that your faster line is always going into the line, the patient's peripheral line first, and then you Y-side the slower line behind it. And if you happen to have stopcocks, you just make sure that the slower lines are going behind those as well, okay? Now, typically your pressors, depending on your policy, should be going through a central venous line. It may start on a peripheral line, and as you have to get higher in your dosages, they may want to switch that over to a central venous line, or you may have to notify the provider, hey, we keep going up and up and up. We need to eventually put this patient on a central venous line. That way you don't damage your skin. Something that can happen is something called extravasation, which means that the medication is actually seeping through the vessels inside the skin and doing damage to that skin. And the skin may become necrotic, may become dark, it may start to become very green, all right? And these are some signs you need to look out for. However, it is your responsibility to know that and be able to inform them, because we're all human and we make mistakes, okay? Another thing you need to know about putting medications and Y-siding them, you want to make sure that any medication that you Y-side, regardless of what it may be, pressors or not, you want to make sure you check the computer and make sure these two medications are compatible and they're able to be Y-sided into the same line. Some medications you cannot mix together, and if you do mix them together, they can crystallize and cause problems within the vessels, okay? So you want to make sure of that. Another issue you may see when Y-siding medications, depending how fast your first line is running, that second line may kind of receive pushback from the first line, and you'll find that your second pump is beeping a lot, okay? And you'll be checking the line, and you'll disconnect it, you'll flush it, you'll check the paint and see what's going on, but you gotta use some critical thinking and try to figure out what's happening, okay? And what may be happening is that that first line is running so fast that that second line is not able to get into the line whatsoever, okay? So this may be a circumstance where you may have to start a second IV to be able to get that second line dripping into the patient without having that beeping of the alarm, okay? So these are just some quick facts that I wanted to go over. Somebody asked me about it today, and I wanted to just run through it real quick, all right? As always, please like and subscribe, and if there's any material that you want to go over or that you want me to talk about, please go ahead and let me know in the comments, and I'll do my best to get to it, all right? God bless you guys.